It is so important, I think, to always acknowledge and understand the role of nurses, not only in our healthcare system, but throughout the leadership structure of the state of New Jersey. And it is wonderful to see the collaboration here between Horizon and these two excellent schools of nursing. Christy Bell and Dr. Popiel, thank you so much for acknowledging and focusing on the role of nurses in how we're providing population health and the evolution of our healthcare system into the future. I also want to recognize Carl Rathjen from Horizon, who is an alum of the Department of Health and Senior Services, and I've had the great pleasure of working with him, and you're lucky to have him on your team. In terms of what many people here have already been talking about, nurses have an incredible and critical role in our healthcare delivery system. I'm well aware of that because of my experience working at NYU Medical Center in the emergency department and really standing side by side with the nursing leadership of that system and watching the care that they provided. It is really the most critical care that you receive in your healthcare experience. I also know the very strong influence nurses could have because there are 140 of them that work in the Department of Health and Senior Services, and some in very critical leadership roles within my agency. My chief of staff was first a nurse. I have an assistant commissioner who oversees all of the survey, licensing, inspection, Allison Gibson, of all of our healthcare facilities in the state. She is also a nurse. And I also have the right hand to the deputy commissioner who oversees all of hospitals and nursing home activity in the state, is also a nurse. So even if I wanted to avoid their advice at times, they are very vocal and strong-willed and extremely intelligent and capable women. And I have to say that it's a great pleasure to work alongside of them in my role as commissioner. The department also recognizes how the role of nursing is not only critical in New Jersey, but also evolving. The department is both supportive of and represented on the Board of Nursing, the Master Plan Steering Committee of the New Jersey Action Committee for Nursing, the New Jersey Initiative Strategic Work Group. I always feel like I should be a nurse after I list all of the things that we're working on. And it's so important to understand how this role of nursing is really evolving. And Dr. Popiel talked a little bit about that and the skills that we need to see moving in the future. It's not just about bringing more nurses into the field of nursing, or more individuals into the field of nursing. It is also about giving nurses that are currently working the skills they need to evolve with the healthcare system as we're seeing it change. The state is working to ensure some of these activities are moving forward through the New Jersey Department of Labor's Healthcare Workforce Council, and Bob Wise, who is the CEO of Hunterdon Healthcare, is the chair of that group. He is working very closely with a number of state agencies as well as community stakeholders to look at what are our needs in the future in terms of the workforce, and then what are the training needs of that workforce to achieve our goals. Today we are here to recognize the goal and highlight Horizon's healthcare initiative and their partnership with both Duke University School of Nursing as well as Rutgers University School of Nursing to train over 200 nurses to serve as population care coordinators to improve the coordination of their patients. And these nurses will work as coaches, as advocates, as providers, and as friends. Patients to really ensure that they're getting all of the health care that they need to improve both their quality of life as well as the health care that they're being provided. This is really about empowerment. It's an empowerment of nurses, but it's also empowerment of patients. One of the things that we have focused in on is the success of this issue, of this type of a collaborative will provide not only improved quality of care, as you will see, hopefully, in reduced readmissions to the hospital, but also improved management of chronic conditions. In the department, we have tried to put some of our resources towards empowering patients to better manage their chronic conditions. We see nationally that 70% of deaths can be attributed to chronic disease. We see that heart disease is the #1 killer of residents in the state of New Jersey. The leading cause of death in New Jersey are heart disease, cancer, stroke, chronic respiratory disease and diabetes. There are over 18,000 heart disease deaths, over 3,500 stroke deaths, over 2,300 diabetes-related deaths. And the percentage of New Jersey residents that are obese, another chronic healthcare condition, is 24%. That's a significant increase from where we were in 1995 at only 14%. So some of our chronic illnesses are really going in the wrong direction. We see that nurses and programs like this can really both empower those patients and educate those patients to make those real changes in their lives and take control of their health so that we see better outcomes as a healthcare system and they see better outcomes as a person. Our department has focused on some chronic disease self-management programs that teach people peer-to-peer how to better manage their healthcare. But you really need a healthcare provider as a partner to achieve those goals, to understand with your shopping bag or Tupperware full of medication, which can you throw out, which are going to have counterindications and cause further problems, and which really are helping you, and how do you take them so that they are the most effective. It's really a pleasure to see Horizon Healthcare, Duke, and Rutgers working together on innovative and creative solutions to these types of problems. This is a business and academic collaboration that we hope to see some real scientific decision-making science for the future, so we can see those results. I would really like to see those outcomes so that we can encourage others to take your lead in making these types of improvements. I think that we have a lot to be proud of here in New Jersey, and these types of initiatives are one of the most exciting things that we see happening in healthcare today. And I just want to thank you for your leadership.